Today we're going to walk through the process of measuring blood pressure through auscultation, a fundamental skill in assessing emergency medical care skills. Step 1. Apply the cuff snugly around the upper arm, positioning it above the elbow. Ensure the cuff's lower edge is about 1 inch above the antecubital fossa, inner elbow. Step 2. Palpate the antecubital fossa to locate the brachial artery for stethoscope placement. Step 3. Position the stethoscope's diaphragm over the brachial artery. Step 4. Inflate the cuff by squeezing the bulb. Increase the pressure to about 20 to 30 millimeters of mercury above the level where the radial pulse disappears. Step 5. Slowly release the valve to deflate the cuff. Listen with the stethoscope for the first Korotkoff sound, systolic pressure. Step 6. Note the reading on the gauge at the first Korotkoff sound. This is the systolic pressure. Step 7. Continue to slowly deflate the cuff. Listen for when the Korotkoff sounds disappear, diastolic pressure. Step 8. Note the reading on the gauge at the moment the Korotkoff sounds cease. This is the diastolic pressure. Step 9. Fully deflate the cuff and remove it from the athlete's arm. By mastering this technique, we can accurately assess a patient's blood pressure.